I'm Danae.
And I'm Shamiah.
And today we're talking about
HIV and AIDS
in Africa.
Africa disproportionately bears the burden of the HIV and AIDS epidemic. Although only 11% of the world's population lives in Africa, roughly 67% of those living with HIV are in Africa. In Africa, there are 22.4 million people living with HIV and 1.9 million new HIV infections in 2008. An estimate of 14 million children in Africa have been orphaned as a result of HIV and AIDS.
Fighting the HIV and AIDS epidemic through education developed Africa's support the fight against HIV and AIDS. Through educational activities, principally, we provide training that aim to correct common misconceptions about HIV and AIDS and empower individuals to make informed decisions about their health. Hey Shamiah.
Yeah.
How are different countries in Africa affected by the HIV and AIDS?
Mother and child both HIV positive at Nigeria District Hospital in Malria. Both HIV prevalence rates and the numbers of people dying from AIDS vary greatly between Africa's countries.
In Somalia and Senegal, the HIV prevalence is under 1% of the adult population, whereas in numerous other countries around 10 to 15% of adults are infected with HIV. Southern Africa is the worst impacted by AIDS. In South Africa, the HIV prevalence is 17.8%, and in three other countries, Southern Africa, the national adult HIV prevalence rate now exceeds 20%. These countries are Botswana, which is 24.8%, Lesotho, which is 23.6%, and Swaziland, which is 25.9%.
West Africa has been less affected by HIV and AIDS, but some countries are experiencing rising HIV prevalence rates. In Cameroon, HIV prevalence is estimated at 5.3%, and in Gabon, it stands at 5.2%. In Nigeria, HIV prevalence is low, 3.6%. Compared to the rest of Africa, however, because of its large population, it is the most populous country in sub-Saharan Africa. This equates to around 3.3 million people living with HIV.
Adult HIV prevalence is in East Africa, which exceeds 5% in Uganda, Kenya, and Tanzania. Overall, rates of new HIV infections in sub-Saharan Africa appear to have peaked in the late 1990s, and HIV prevalence seems to have declined slightly, although it remains at an extremely high level of 5% among adults. The history of AIDS in Africa has more information about how HIV prevalence has changed over time.
Mother-to-child transmission of HIV. Around 360,000 children in sub-Saharan Africa became infected with HIV in 2010. The vast majority of these children have been infected with HIV during pregnancy, childbirth, or breastfeeding as a result of their mother being infected with the virus.
HIV and AIDS related treatment and care in Africa, which is the impact.
Hey, Danae, what's the impact on HIV and AIDS in Africa?
The impact of AIDS in Africa between 1999 and 2000, more people died of AIDS in Africa than in all the wars of the continent. As mentioned by the United Security General, which is Kofi Annan,
the death toll is expected to have a severe impact on many economies in the region. In some nations, it is already being felt like life expectancies in some nations is already decreasing rapidly, while mortality rates are increasing.
In 2000, it began with 24 million Africans infected with the virus. In the absence of medical miracle, nearly all will die before 2010. Each day, 6,000 Africans die from AIDS. Each day, an additional 11,000 are infected.
33.4 million living with HIV, 2.7 million new infections of HIV, 2 million deaths from AIDS. Approximately 7 out of 10 deaths for 2008 were in sub-Saharan Africa. a region that is also over two-thirds of adult HIV cases and over 90% of the new HIV infection among children.
AIDS affect different segments of society in different ways. For example, children may have to care for an ill parent. Schooling may suffer as a result. Other times, children become orphans as parents succumb to AIDS. If they are lucky, children may have grandparents or relatives to help who they face the burden of raising many children, as the London-based organization Panos highlights.
A number of countries in the region have implemented national campaigns and to encourage uptake of HIV testing. Botswana, Kenya, Eugenia, Malawi, and Rwanda are some of the countries that have conducted testing campaigns that increased the number of people testing in 2010. Overall, nearly 6 million people aged over 15 years received HIV testing and counseling in Kenya in 2010, and increasing over a million compared to 2000 figures. 17 Rwanda has also succeeded in improving the number of people receiving HIV testing and counseling, with 469 per 100,000 individuals over 15 years receiving this service in 2010, a total of 2.4 million individuals.
In South Africa, the number of people receiving HIV testing and counseling has significantly increased in recent years as a result of the government's national HIV testing campaign. However, the estimated number of people receiving HIV testing and counseling in 2010 was more than 6.5 million. This is notably less than in 2009, when nearly 7 million people received testing and counseling. Across sub-Saharan Africa, it is estimated that 82 tests per 1,000 people were carried out of 2010.
HIV and AIDS awareness. Billboard and Lugina, Zambia, a number of African countries have conducted large-scale HIV prevention initiatives and an effort to reduce the scale of the epidemics. Senegal, for example, responded early to the emergence of HIV with strong political and community leadership. It is impossible to predict how Senegal's epidemic will have progressed without intervention, but Senegal now has one of the lowest HIV prevalence rates in sub-Saharan Africa.
The situation in Uganda was similarly successful. HIV prevalence among pregnant women in Uganda fell from a high of around 30% in the early 1990s to around 10% in 2001, and is now estimated to be 6.5%, a change which is thought to have been largely a result of intensive HIV prevention campaigns. However, a high rate of new HIV infections in the country has led to fears that HIV prevalence may increase again. Declines in HIV prevalence have also been seen in Kenya, Zimbabwe, and urban areas of Zambia and Burkina Faso.
However, not all African countries have such successful HIV prevention campaigns. In South Africa, the provincial government's failure to respond to the AIDS crisis has led to an unprecedented number of people living with HIV. Despite recent improvements, an estimated 48,000 babies are still born with HIV every year, reflecting continued failures in prevention of mother-to-child transmission and victim.
Condom use in HIV. Condoms play a key role in preventing HIV infection around the world. In sub-Saharan Africa, most countries have seen an increase in condom use in recent years. In studies carried out between 2001 and 2005, 8 out of 11 countries in sub-Saharan Africa reported an increase on condom use.
The distribution of condoms to countries in sub-Saharan Africa has also increased. In 2004, the number of condoms provided to this region by donors was the equivalent of 10 for every man, 14 compared to 4.6 for every man in 2001. However, this was still estimated to represent an annual gap of anywhere between 1.9 to 13.1 billion condoms.
Relative to enormity of HIV and AIDS epidemic in Africa, providing condoms and cheap and cost effective. Even when condoms are available there are still a number of social, cultural, and practical factors that may prevent people from using them. In the context of stable partnerships where pregnancy is desired or where it may be difficult for one partner to suddenly suggest condom use, this option may not be practical.
Provision of voluntary HIV counseling and testing. Chief Chiquita and a VCT sign in Zambia, the provision of voluntary HIV counseling and testing. VCT is the important part of any national prevention program. It is widely recognized that status are less likely to transmit HIV infections to others and are more likely to access treatment, care, and support that can help them to stay healthy for longer.
Now we're going to give you 11 facts about HIV and AIDS in Africa. The first case of HIV and AIDS in Africa was reported in 1982.
Of 33.3 million people living with HIV and AIDS across the world, 22 million are in Africa.
More than 29.4 of people are said to be living with HIV and AIDS in South Africa, the highest number of any country in the world.
In 2009, 1.8 million people died due to HIV and AIDS. 1.3 million lived in Africa.
Women account for 59% of adults aged 15 and over said to be living with HIV and AIDS in Africa.
South Africa has been hardest hit by the AIDS epidemic. 1 in 5 adults is HIV positive.
South Africa also has one of the highest numbers of children under 15 living with HIV and AIDS in the world. Estimates ranges from 1,800,000 to 2,800,000.
2.5 million people in Africa receive antiretroviral therapy, medications for the treatment of infection by retrovirus, primarily HIV.
An additional 8.7 million are in need of ART.
There are 15 million AIDS orphans living around the world, 13 million of whom are in Africa.
HIV is the leading cause of death in sub-Saharan Africa.
And that's our facts on HIV in Africa.
Bye.